if you're dealing with disease entities, whether it's children or adults, or whether it's asthma or diabetes, there is a role for psychological factors. I think that there is a role for the patient in dealing with his or her own disease, and I think that self-regulatory processes are a part of this whole process, and your choice is whether or not to ignore them or to use them. And I think hypnosis represents one of several self-regulatory processes that can have beneficial effects in dealing with the whole patient.
The pediatrician in practice can benefit a great deal from learning these strategies. I certainly used them a lot when I was in a general pediatric practice. I remember, for example, very vividly a little 3-year-old boy. When he came in for his 3-year exam, I taught him about turning off switches, how he might turn off switches so that he'd feel more comfortable with injections and so on. And 6 months later, I met that same child in the emergency room. He needed to have sutures for a laceration. And I said, "Nick, do you still remember about those switches?" And he said, "Yeah, I already turned them off."